Hi guys, welcome back to Skincare Sunday. Dr. L here. Today's topic is when should I start Botox or other wrinkle relaxers like Dysport, Jeuveau, Xeomin. These treatments are phenomenal anti-aging treatments. They relax muscle movement and decrease fine lines and wrinkles. When is the best time to start these treatments? Let's talk about that. So a big component on that decision is age, but not all of us age equally. So there's a lot that goes into our actual physical age, the way we appear, and it has a lot to do with our skin color. So individuals with darker skin are protected against the number one aging thing, which is the sun. And individuals with lighter skin are less protected. Also, the age of your skin and what kind of wrinkles you're seeing, depending on your age, really also depends on the amount of sun you've had, or tanning booths, which you should never do. If you protected your skin and you've avoided the sun, even if you're fair, you're going to see less aging. So on average though, for somebody who is fair-skinned, I would say probably the late 20s if I had to kind of guess when you should start. But let's talk a little bit more about the details of that. So definitely you want to start when you start to see static lines. So those are lines that are present in the skin without movement. So you see lines when you move, right? I can move because I can't get tox. But when you see lines that are there without movement, those are called static lines. That is the time to intervene and start relaxing the muscle movement so we don't end up with etched in lines, which are lines that are very deep, difficult to treat without multimodality. So they will not be released with just tox. They will require skin health treatments. They will require skincare, collagen building with microneedling, etc. So if you are starting to see lines at rest, static lines, get in, start relaxing that muscle movement before they become etched in lines. Another component that goes into the decision of when to start wrinkle relaxers, such as Botox and Dysport, is the strength of the muscles. So some individuals I see in my clinic have very strong genetic muscle size. So they have, and it's typically here, but sometimes it's up here, sometimes it's the eyes. Those are the three major areas that we treat. But typically, like I said, I'll see here where I have a patient who has this strong genetic lamellar complex where they have etched in lines very young, and it's typically inherited from one of the parents or both. And that would be something I would intervene on sooner than later to start decreasing the size of that muscle and its ability to really bring the skin together and create a deep etched in line. Again, avoiding etched in lines is the goal. Let's talk a little bit about prevention as well. So some of my patients take really good care of their skin. They avoid the sun. They're not seeing really dramatic static lines, meaning lines at rest, but they want to do prevention. They want to avoid seeing those static lines and etched in lines. So prevention, I typically will recommend a low dose kind of overall treatment, nothing that will take away all movement. Obviously, taking away all movement is unnatural. So I like to avoid that even in patients who are not doing prevention. But in my prevention patients who are very young, I would say, mid-20s to late 20s, you can start getting low doses of wrinkle relaxers to prevent lines. And that is a beautiful thing. All right, guys, that is all for Skincare Sunday. If you guys have any questions about wrinkle relaxers, please drop us a DM. We'll be talking about them all week this week.